Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, some hospitals are seeing a slight uptick in COVID-19 patients as the health department detects more subvariant cases. A presidential advisor is urging authorities to approve a second booster dose for company employees. And what are the challenges for the country's next health secretary? Outgoing Health Secretary Francisco Duque joins us live. There's a slight increase in the number of COVID patients in some hospitals as the health department records a steady rise in infections. Carolyn Bonkin gives us a look at the situation at the San Lazaro Hospital in Manila.
A man was rushed to San Lazaro Hospital in Manila on Wednesday afternoon. Having difficulty breathing, health workers gave him oxygen supply. He's a suspected COVID-19 patient.
San Lazaro Hospital saw fewer COVID-19 patients in April and May, but this month, more people are coming for COVID-19 testing and consultations.
Ngayon po, we have 25 cases admitted. Although mababa po ito, but compared to 2 weeks ago, we only had 8 admissions.
Most patients here have mild and moderate COVID-19 symptoms.
If we see a need na wala po silang mauwian, wala pong isolation for them, so ina-admit po namin for isolation or quarantine purposes.
Should cases go up further, Dr. De Guzman says they're more prepared now. The hospital has kept its COVID triage and testing areas intact. A new building for emerging and re-emerging infectious diseases opened this year, with additional beds for COVID-19 patients. Medicines and equipment all stocked up.
Nag-level 1 tayo. It has given us time to recharge.
There are still over 150 empty COVID beds. The health department reports over 450 daily COVID-19 cases in the past week. That's almost the same as those recorded in the second week of February. But health officials do not see a need to raise the alert level.
Hindi sumasabay ang severe and critical. It is not translating to a higher admission in our hospitals.
Let's put it in perspective. We had 18,000 cases a day in Metro Manila in January. Ilan kahapon? 218. Ang layo-layo nun.
But DOH shares latest projections, citing another possible surge in infections by third week of July to first week of August, with a presence of more transmissible and immune-escaping variants, low compliance to health protocols, and slow booster uptake.
Pinaka-importante ngayon sa ating mga komunidad, lahat na magkakaroon ng simptomas, isolate at once. Magpabakuna na po tayo kung tayo po ay eligible.
Health officials report 32 more transmissible Omicron subvariant BA.5 cases on Wednesday, but say there's still no community transmission yet, as the cases could still be linked together. Caroline Bonkin, CNN Philippines.
Let's go straight to the source of the story. We have Outgoing Health Secretary Francisco Duque. Secretary Duque, welcome back to the source. Good to see you again, sir.
Oh, certainly good to see you. Thank you in behalf of the department for giving us the opportunity to share with you latest info on our COVID pandemic response and other related public health issues.
Let's start with the cases. Secretary Duque, almost 600 cases recorded yesterday, half of those detected in Metro Manila. Is this beginning to be a cause of concern for the health department?
Well, you see that increase is not the same as the way we had the surge in January. No? In January, we had yung peak ng surge natin, nagka-34,000 a day tayo. No? So just to put it in context and in the proper perspective, of course, any increase is a cause for alarm. But suffice it to say that for as long as our people continue to comply with the minimum public health standards, and in particular, good masking compliance, then we will be able to manage this and really not see huge or massive increases in the number of cases. Besides, if you have to look at the other metrics, no, yung average daily attack rate is nationally less than 1 per 100,000 population. So, mababa pa yan. In fact, for the alert level or the risk classification to go moderate, kasi ngayon low risk tayo nationally, no? Para maging moderate risk yan, it has to be 6 to 18 average daily attack rate per 100,000 population. So malayo. And we're just less than 1 now. And then our healthcare utilization rate is also nationally below, I think it's about 20% more or less, no? So we have to be alert. We have to be on, we just have to continue to remind our people two things, no? Masking and get your vaccination, get your boosters once eligible. So, and of course, the other elements of our minimum public health standards. Yun lang naman, yung talagang sagot dyan after 2.5 years of our experience.
Other factors also, no, Secretary, that need to be considered would be the positivity rate. I saw that the positivity rate is at 4.4%. Hindi ho bang threshold ng WHO is at 5%. So malapit na po tayo doon.
Malapit na tayo doon, 5%. But ngayon, hindi mo naman pwede ikumpara itong situation natin today with that of 2020 na walang bakuna, hindi masyadong maganda yung masking, yung minimum public health standards compliance. Ngayon, may bakuna na tayo. So makikita mo yung severe critical cases, mababa, no? Deaths natin, mababa, no? Tuloy-tuloy na mababa. So the situation today is far different from what it used to be last year, first semester of last year, and even more different from the entire 2020 COVID situation.
So it's good to find out from you, hindi na po natin, is it possible or hindi malayo ho tayo na makita ulit yung surge that happened during the Delta or Omicron in January or February? Hindi na po mangyayari yun ulit.
Yung Delta, nag-surge tayo, that was August, September, no? And then the Omicron was January. Hindi natin pwedeng sabihin hindi na mangyayari because, the virus is notorious for mutations, no? And the problem with the virus is the unpredictability. So, having said that, we don't know because Omicron pa lang, sangkatutak na subvariants na lumabas, which everyone, every variant or every mutation has brought about higher transmissibility. But despite all these mutations, no, despite all these sub-variants, no, walang evidence to show that this is causing more severe or critical COVID cases. So, thankfully, kahit na nag-mutate siya, sana hindi siya magiging mabangis, hindi siya magiging peligroso, hindi siya magiging deadly. No? So, we can manage this to, the objective kasi is to manage these cases na wag masyadong tataas, no, na hindi ma-overwhelm yung ating health system. Yun lang yung objective natin dyan. So, protect the vulnerable population, okay, A1, A2, the senior citizens, and then A3, persons with comorbidities, by way of vaccination, okay? And also, constant reminder that minimum public health standards compliance provide 90 to 95% protection from getting the COVID.
Let's talk about your projection, Secretary Duque, on the number of cases by possibly end of June or even end of July. What numbers are you seeing?
Well, by end of June, the autumn Australian tuberculosis monitoring network, no, ang sinasabi nila, between 800 to 1,200, no, sa NCR. Pwedeng sumipa yan. Pero by end of July, pwedeng umabot yan ng 1,500 to about 2,000 cases. Daily, daily. And after that, magpa-plateau siya to below 1,000. So hopefully that projection will, may assumptions kasi yan eh, no? Ang assumptions mo dyan, if there's a drop or reduction in the mask compliance, no, or MPHS compliance. Number two, the booster coverage remains low, no. Number three, if there's going to be more transmissible subvariants or sublineages of Omicron. And then, of course, lastly, you know naman, the waning immunity, no. That's why we keep reminding people to get your vax and then get boosted once you are scheduled, no? Kasi may schedule yan, no? Every 3 or 4 months, kailangan from your last primary dose series, magpa-booster ka na. And yung umpisa na natin kahapon, yung immunocompromised booster dose for 12 to 17 years of age.
Opo.
So we will expand all of this as we also expand access points, no? Yung res bakuna sa klinika, res bakuna sa butika, res bakuna sa mga palengke, sa mga simbahan, sa mga airports, seaports, land transports, terminal exchanges, UOTR, mga PETA, simbahan, eskwela. So, yun ang pwede natin gawin. You know, ang problema natin talaga is wala tayong vaccine mandate. I broached that idea, but that was thumbed down by Congress. So, we'll see if the next Congress might be more receptive to a possible policy adoption of mandating vaccination, but with clear exceptions, no? So, hindi naman lahat talaga pwede mong bakunahan. So, may mga exceptions.
Secretary, you just need to take a very short break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our source today, Health Secretary Francisco Duque. Secretary, we're still at low risk classification. The DOH already said that there is still no community transmission. What are the factors that you are seeing that will warrant an increase of alert level from 1 to 2?
Well, you know, essentially, it's the healthcare utilization rate. Pagka sumipa ito ng 50% to 70% of our healthcare capacity, that should be a more sensitive metric that will signal the need to escalate should that happen.
Okay. What about the quarantine facilities? Do they need to be reactivated again in the event that hindi na po sila nagagamit ngayon? Dapat hubang maghanda na muli yung mga LGU to open these quarantine facilities?
Meron silang mga quarantine facilities. You know, if you recall, no, during the surge Alpha, Beta, and then the Delta, and then Omicron, the latest, no, in January, maraming capacity tayo. We have expanded capacity so much, no? So yung bed capacity natin for temporary treatment and monitoring facilities ay sa kasagsagan niya, 110,000 beds tayo. About 8,000 facilities all over the country, no, national, local, and in fact, even the private sector contributed to an expanded the TTMF bed capacity and increased number of facilities, plus the mega TTMFs. So we are more agile now. We are more ready. We can manage this. And hopefully, we must all realize that the assumption is that the virus will be here to stay. It's not going to leave us. Okay? So, if we are going to usher in the new normal, which I believe we already have, no? Yun yung philosophical underpinning. The virus will stay. It will remain. And so we will just have to manage this so that the cases and transmission is low, not enough to overwhelm and overstretch our health system's capacity. So,
President Rodrigo.
yun lang tayo. So, in terms of capacity, meron tayo. But alam mo kasi, we have adopted the accordion principle, no? Ibig sabihin na accordion principle, pagka may surge, we will allocate more beds to COVID. Yun lang yun,
Yeah.
ginawa natin. We
Yeah.
convert more non-COVID beds to COVID. But you see,
Right.
now, we are also having an increased admission of non-COVID cases. And mababa ang COVID cases. So, ang accordion, now that andyan na yung mga non-COVID cases natin na na-delay for 2 years, yung hindi nagpakonsulta, nagtakot, hindi nagpa-opera, hindi yung elective surgeries, lahat na-postpone. Ito, nagbabalik na sila with the bed jobs. So, what we do is bring back the pre-pandemic COVID bed allocation for non-COVID cases, usually non-communicable diseases. No? So, isa pa rito, ang bago natin innovation, we broadened the care pathway. Downstream, meron tayong home isolation na Pinky. Alam mo, nag-home isolate ng mga tao. In fact, part of our Vida Solution campaign is isolate when sick or ill, no?
Right.
Or when symptomatic. So, marami tayo talagang mas napalawag natin ang capacity.
Secretary-
Ito include home isolation with PhilHealth benefit package.
Opo. President Rodrigo Duterte had ordered hindi ho ba the mandatory use of face masks till end of June. What is your suggestion? Should the mandatory use of face masks be extended?
Well, kung ako tatanungin mo, I will recommend that it should be extended because we see there's already an increasing number of cases. No? So anything that will be the opposite of that is rather strange. No? So that kung tumataas ka, bakit ka magluluwag? Di ba? So dapat ipagpatuloy na lang dahil maraming value add naman ng masking, hindi lang laban sa COVID-19, maraming laban sa influenza, bacterial pneumonia, ang dami pa mga sakit. Buti nga lang, wala pa tayong monkeypox. Hopefully, we will not have monkeypox. But mask will also help prevent monkeypox virus from spreading. No? So, ano ba naman yung mask? Diba? This is really something kung may asthma ka, nakakatulong din yung mask kasi you filter out the pollens and other allergens. No? So, ang daming value add. So, I think we should be more understanding of the value add of using masks and other minimum public health social measures. No?
Let's talk about booster shots. 14 million, I believe, so far have gotten their booster shots. And you were saying, of course, minimum health standards, vaccines, and booster shots are very, very important. We have about 70 million who have been fully vaccinated, meaning first and second dose. Pero mababa po yung sa booster shots. How can the government, especially now, sir, encourage more people to take their booster shots? In other words, their third shot.
Yeah, you're right. That's a point of concern, na mababa yung ating booster dose coverage at only 26%, no? Only about 14 or 15 million more or less of about 56 million eligible population. And we keep reminding, yun lang pwede natin gawin. Education, counseling, nudging, incentivizing. I think the private sector and the local government units have been quite creative, if not innovative, in terms of improving booster uptake by way of mga discounts, no, sa private sector, by way of mga pabingo sa mga local government units, pagbigay ng mga health kits, yung incentivization. I think that is what we continue to do together with the local government units and also the private sector.
What about the second booster shot, sir? Is this
Even
something that the Department of Health should already recommend?
Oh, the second booster shot for what? The general population?
Yes, sir. The general population, including, of course, the employees, as something that is being suggested by Secretary Joey Concepcion.
Well, two things, no? Number one, we listen to our experts. Okay, we don't listen to anybody else but our experts. We do not like pseudo experts. So the experts, the Health Technology Assessment Council members, the Vaccine Expert Panel, the technical advisory group, wala silang ganun pa. In fact, ang tag on technical advisory group, sinasabi nila, maliit ang value ng booster for the general population outside of the A1, A2, A3, and the immunocompromised. No? So, gusto nila yung 50 years old, ibaba yung threshold from 60 to 50 years of age. We'll wait. We'll see what new data will reveal. Anyway, as other countries are doing it, we continue to review the body of evidence, the summary of evidence, no, the data, and our experts are really, very closely monitoring the developments in terms of safety, efficacy, continuing effectiveness of the vaccines. No?
Again, we need to take another short break. This is The Source on CNN Philippines. Please stay tuned. Our source today, Outgoing Health Secretary Francisco Duque. Secretary, could you kindly quickly respond to the complaints of some healthcare and non-healthcare workers serving as frontliners in hospitals during the COVID pandemic, that about 100,000 of them still have not received their OCA or their allowance? Mabibigay ho kaya ito very soon?
Alam mo, Pinky, mabuti tinanong mo yan. Talagang pinag-akin, minomonitor yan, yung release na yan. Dahil talagang they deserve it, these benefits, the one COVID allowance is long overdue. But you see, in government, you have to deal with COA rules and regulations. You cannot just disburse funds without those facilities that have received the first round of benefits, walang liquidation. They have to liquidate. Wala na tayong magawa. Alam mo, pinakamadali magbigay. Una-una, may pondo naman. Okay? Pwede naman natin ibigay yan. Pero sinabihan na namin ng mga ospital, ito mga private hospitals and a few LGU hospitals, sinabihan na namin, you please submit the liquidation report and also the memorandum of agreement. Kasi lahat ito are embedded in the guidelines for the grant of such benefits, no? And also under the law. So you cannot just be disbursing public funds without the proper accountabilities, without the proper liquidation report. Pagka na-liquidate nila, sabi ko nga, kahit na partial liquidation, pwede na. No? Kailangan talaga may liquidation. Otherwise, ang DOH will be liable. And it will be a subject of a COA observation and a possible disallowance. Kawawa naman yung mga empleyado ng DOH.
So ang lumalabas, Secretary,
ang
lumalabas po ang problema, hindi po naliliquidate ng mga ospital, kaya po hindi nabibigay. Okay, all right. So I have 2 minutes left. Just that, it's probably 7 days outgoing na ho kayong health secretary, and I'd like to thank you for always being available for our interview, sir. But I wanted to find out from you, because you are leaving soon. What were you most proud of as health secretary? 2 things na lang po. And the second is, isasabay ko na po, in hindsight, what could you have done better?
Okay, what I'm proud of is the results that we see today and enjoy. The Nikkei COVID Recovery Index has cited the Philippines as one of the 2 countries that have substantially improved in its COVID pandemic response by now having low case transmission, relatively high primary series vaccination coverage, and the loosening up substantially of our mobility restrictions, and therefore the economic recovery is very much on rebound. So this is one thing that we're proud of. As I have been always on top, the AH1N1 pandemic, you also interviewed me when we had that pandemic. Remember, Pinky, yung AH1N1 pandemic of 2009, no? So this is not the first time that we have we have been given the opportunity to serve. And I thank the President for his continuing trust and confidence. Now, the question is, what should have I done differently?
Yeah, what could you have done better?
Alam namin, at first kasi maraming mga bumabanat sa amin. Maraming nagbabash sa amin. Lalo na ako in particular, mali-mali daw yung ginagawa ko, incompetent, mabagal, etc. But how can you argue with the results now? No? Number two, there is always room for improvement. But you see, you have to understand that this virus is a relatively new virus. There has been no pandemic of this magnitude. Of course, we had the 1918, parang ang tagal na noon, di ba? Iba na ang panahon ngayon. But it looks like, hindsight, yung akalang mga mali na ginagawa namin, ngayon, lumalabas tama yung mga policies na yon. I'll give you one good example. Our detractors kept assailing us, attacking us for not doing mass testing. Again, ang inadapt ng IATF, based on the experts' recommendation, was to stick to a risk-based targeted testing, which has a much higher value in terms of reducing risk of transmission and of cutting chains of transmission. So, okay yung mga policies natin. 200 plus policy issuances of IATF, which later served as a basis for our protect, detect, isolate, treat, reintegrate, and vaccination strategy. So, ngayon, alert level 1 na tayo. A big number, a majority of our regions are under alert level 1. And then, ngayon, nabigyan pa kami ng Institute for Solidarity in Asia, we were awarded yesterday after the public Vivalida a gold governance trailblazer award. So I think the DOH and our people are really dedicated, committed, professional civil servants, in whose hearts, really the interest of the people.
Thank you. Okay. All right. Outgoing Health Secretary Francisco Duque, sir, again, maraming salamat po sa inyo. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.